So I chose to become a doctor because I love the interaction that I get with patients and people in the surrounding community. And I love to be able to set health goals for people and see them through with them. I decided I wanted to be a physician when I was really young. It's something I've always had a passion for, specifically primary care as well. So I love working with adolescents, adults, athletes, and that's kind of what led me into my career in sports medicine as well. I feel like I have been able to combine those two together to kind of lead me to this point. Well, my interests in the field include, working with the patient on a team-based approach. So not only utilizing myself, but other professionals in the field, such as pharmacy, physical therapy, occupational therapy, counseling, psychology, things like that. I feel like that whole health approach really is the best way to treat a patient. With this guided therapy that we use, we treat, common orthopedic problems, including tendonitis that has been going on for a while, arthritis, and just other chronic ailments that aren't getting better through just conventional methods such as, anti-inflammatories, rest, ice, things like that. Sometimes we need to be a little bit more aggressive in our treatment. The majority of orthopedic problems that people go to the surgeon for really don't always require surgery. So in a lot of these instances, simple steroid injections work, physical therapy, occupational therapy. But sometimes, at the end of the day, we're still not to where we want to be. And at Falcon Health Center, we have the ability to use ultrasound-guided injections where we use similar injections, but we can specifically place it in the area that it needs. We also offer regenerative medicine here where we do platelet-rich plasma injections where we're not using steroids, but we're using your own blood to heal tissue. As a first visit when you come in, obviously it's important to get to know the patient, learn the patient's background. So a lot of that visit is just getting to know you, your medical background, family history, so we can kind of get a whole idea as to everything that's going on and kind of come up with an idea of where we need to go treatment-wise, if we need to do anything at all. So a lot of the first visit involves us getting to know each other and forming a good treatment plan going forward with you. I love meeting patients' goals and I love seeing them achieve a healthy lifestyle. When people come into me, they're looking at me for help and guidance, and I love being able to work as a team with them to achieve the goals that they want to do. And I can't tell you how many times I've seen patients come back just smiling and happy because we've achieved something that they may have not thought was possible. That's kind of what drives me and pushes me to come in every day, because I love that interaction that you make. And I think that's something that's really powerful and unique in this profession, in that we're truly helping people achieve healthy lifestyle goals and become happy.